Good afternoon all, and welcome to today's meeting of the Adults, Communities Overview and Scrutiny Committee. As usual, this meeting is being broadcast live to the public. For those not able to watch live, the webcast will be recorded and made available for viewing on the County Council's website after the meeting. As usual, can people please switch on the microphones when speaking and turn it off once they finish speaking. And if everybody can make sure their phones are on silent, that would be fine. Agenda item 1, minutes of the meeting held on the 20th of January. I propose that the minutes of the meeting held on the 20th of January are taken as read, confirmed and signed. Is that agreed? Thank you all. Agenda item 2, question time. There are no questions received from members of the public. Agenda item 3, questions asked by members under Standing Order 7.3 and 7.5. No such questions being received. Agenda item 4, to advise of any other items which the Chairman has decided to take as urgent but not covered elsewhere on the agenda. No urgent items have been put forward. Agenda item 5, declarations of interest in respect of items on the agenda. Do any members have any declarations of interest other than the usual one of district councillors? Thank you. Agenda item 6, declarations of the party whip in accordance with overview and scrutiny procedure rule. Do members have any declarations of the party whips? No, thank you. Agenda item 7, presentation of petitions under Standing Order 36. No petitions have been received. So we have 3 reports today. So the first report is agenda item 8, which is the peer review of Pathway for Adulthood, pages 11 to 42 of the agenda pack. And I think John is taking this one.
Thank you, Chair. I'll do a very brief introduction and hand over to colleagues. So this is a follow-up report to a report the committee had in September of last year following a peer review of the councils preparing for adulthood services and the Younger Adults Disability Team. That peer review took place in May of last year. Was undertaken by a group of colleagues from across the East Midlands who came and had a look at the services that we deliver and provided us with a report, which, as I said, we initially presented to committee in September last year, and committee asked for a follow-up report on the actions that we'd undertaken, and that's the focus of today's report. Just before we go on, just worth noting also that we have now commenced a corporate preparation for adulthood review, which is taking place across children's and adults services and is due to report in the autumn of this year. And some of the actions, as you'll note as you go through the report, will be taken forward as part of that review. But I'll let colleagues just present on where we've got to with those.
I'll just come back on that one. We did ask John in the chairman's briefing about this, and we have agreed, taking advice from Joanne, that the best way to tackle this is for a further report to come back to adults communities about that work at an appropriate time, which by the sounds of it will be September, October time. So it will be covered then. I forgot to mention, so apologies, that John is joined by Santop Dulai and Claire Williams. So we've all read the reports. So it's a question of, are there any particular bits you wish to highlight before we take questions?
Thank you, Chair. I was going to say I'd take it read that the report's been read, and if, with your permission, we can just focus on the actions and the update on the actions rather than the whole report itself. I'm quite happy to go through individual action, and then if you want to happy to take questions as we go through it, rather than wait to the end. Yep.
Right, whichever suits you.
Okay, thank you. So starting with the paragraph 14, the first action was, I won't read the action if that's okay with yourselves. The response from our point of view was that we now actually have a very strong interface with our children's social care service and our YAD service, as well as our SEND colleagues within children's. So that was one of the things that was missing. The peer review had highlighted. We've now got regular meetings, and we're actually having very clear dialogue about those young people that are coming through, getting ready for adulthood much earlier in the process. We're also now on a quarterly basis, Claire, Claire's the head of service for YADS, is meeting with her independent reviewing officers on a regular basis. So again, that was one of the areas that was missing. We weren't linking up really well, but we've got that in place now, regular meetings taking place. Alongside that, it's very clear that we need to undertake joint training on the key areas that actually affect and impact on children and young people. So that addresses that action. Any questions on that before I move to the next one? Okay, thank you. Action B, the peer review. This was really around considering the pathway young people who don't have an EHCP was clearly less defined. This is one of those actions we recommended to be transferred over to the corporate review for PFA. There's a lot more work to be done with this pathway. It means undertaking a lot of joint work and much more robust dialogue with our children's colleagues. So we've transferred that over. It just made absolute sense for us to move it into that peer review, and we will report on that action as we go along. We won't be lost within that process. It'll be part of the update reports. Any questions on that one?
No, it was just on that point that I said we will include it as an action point, and it will be in the agenda setting. We will put it on the forward plan going forward for those that replace us or whoever gets elected and is on this committee, so that, again, as Santok very kindly said, it doesn't get missed. But we just want it. We know it won't get missed. We just need to cover off the nuts and bolts of making sure it doesn't get missed. So thank you for that.
Yeah, page 13, item D. Could you explain that a bit more to me, please?
I think we're just coming down to D. I
I got that, yeah.
Santok's going down each one, I think. So I think.
Right.
Sorry, I'll come to that in a second. I've
So
got one more.
if you're happy, Bill, we'll pick
Yeah,
that up when we get
absolutely.
there.
Okay. Action C, action C, we'll call it action C. Again, that's one of those where we currently use a triaging system, a risk tool, which the peer review didn't find was working as effectively as it should be in terms of identifying, triaging those young people that needed immediate support and those people that needed less, and we could take some time in getting around to them. What we've done, again, as part of the corporate peer review, we've pushed it into that. Again, that's a strong dialogue, but at the same time, we're working on a here and now solution in terms of how we manage that triaging more effectively so no children get missed in any shape or form. And that is a business case that's being developed and will be presented to the two directors for consideration fairly soon.
Fiona.
Thanks, Chair. Hi, my name is Fiona Barber. I represent Healthwatch Leicester and Leicestershire today. Firstly, the report's really great, lovely, transparent. It really helped me understand what's going on. Just a query from Healthwatch, really, in relation to what you're saying in terms of the delay for this, because this is around identifying young people's needs, particularly those that have immediate needs, and any delay is obviously not an advantage to those young people. So what assurance can you give Healthwatch and other people and colleagues around the table in relation to how long that will take to actually impact on young people? The stopgap measure you're putting in place before they review reports.
We're continuing to use the triage tool at this point in time until we get the business case through. As soon as the business case has been agreed with our children's services in terms of identifying those people that have a particular criteria that's more appropriate for YADS, then we'll implement it at speed. And it'll be a pilot. I think we're looking at a pilot for 12 months in order to take the learning from that to make that either much more fine-tuned, much more robust. The main aim is, the main outcome is we don't miss any children. So, and that's the key concern for ourselves. So we want to make it so it works effectively and appropriately for those young children. So as soon as we get the business case signed off, we will absolutely implement it.
Thank you, that's really helpful. What timescale are you looking at for that business case?
Yeah,
So we've already got the plan. We've got the plan in place already of how we identify young people. This is about enhancing the way that we do that to make it more robust. So the business case has been designed and developed. So we need to just make some amendments and present that back to the two assistant directors. And I would envisage that that would take probably between the next 2 to 3 months. Thank you.
Item D, we're replacing the way we work with our vulnerable people in terms of the model of interaction, model of gathering and information. We've now taken the view that we've implemented the 3 C's conversation, and the conversation 1 is really about gathering that information, letting the person direct that conversation in terms of what they want to talk about, what their hopes and aspirations are, and the outcomes they want to achieve. And we've already started to see some success in terms of directing young people more appropriately towards enablement rather than more formal care support. But where it's appropriate, we move on to conversation 2, which was a much more enhanced assessment type process. And where at the point of conversation 1 it becomes very clear that a person will need long-term support and care, we take them into the conversation 3, which is the old Care Act assessment and support planning. But it actually, this method of working with the person allows them to control that conversation. And I think what we're getting is much more richer involvement, much more richer outcomes that people are wanting to see delivered in their lives. So in a way, it just produces that much more choice and control for that individual in that conversation.
Do you want to come back, Bill?
It's more person-led rather than system-led.
It's very much person-led, but it's also very strengths-based. So it's not a negative. You start off on the strengths and try and maintain those strengths that the person already has, and absolutely work around that for them. It is very much about delivering independence and choice and building that resilience within that individual.
A question from Phil.
Sorry, thanks. Yeah, so one thing, sorry, I think you considered this before I joined the committee in late last year, but one of the questions that's just entered my head is basically, well, how many people are we talking about here in these different streams? Because I've got no sense of numbers here. What are we talking about? And maybe that's in the background reports and all that detail, but I just don't have that handle on that. Thank you.
Just to clarify, you're asking how many numbers for conversation 1, how many numbers for conversation 2?
No, what I'm trying to understand is how many. So we've got 2 kind of pathways. Well, there's multiple pathways of how young people who've got disabilities come in to be kind of transitioned to adulthood, whatever that means. So you've got young people who don't have a PHCE, and then you've got young people who do. And what this is saying is there's I hate this expression, but it's kind of there's two streams in effect. And the people who don't have a personal healthcare education plan kind of feel like they're kind of, not quite at the same level. And I can understand that. So what I'm trying to understand is, well, how many people are we actually dealing with per year in all of those kind of different criteria? Because I don't understand how many people, what's involved here. Is it, it must be, I assume it's hundreds, but I don't know. And I'm just trying to understand the scale of what we're talking about here and how many people, and you said, and then, how many people are going through conversation 1, 2, 3. I presume everyone goes through conversation 1, 2, 3, but they don't have to. They might decide to have no conversations, just do the first one. So what's the kind of fall away rate, if I can put it like that, before people get to the end, go through all, what are we talking about, basically? Numbers. Thank you.
Say the current caseload, active caseload we have within the YADS is about 350. young people on our books at one time. In terms of the people with the HCPs, I haven't got the figures, but I can certainly present those unless you've got them.
I haven't got the data to hand. The 350 would be the annual number of young people that present to the Young Adult Disabilities team. The pathway for young people who don't have an education, health and care plan, we do still offer that transitional support, but their primary need tends to be in relation to their mental health. So they go to our operational commissioning mental health team for that support, and we're talking very small numbers. So I think as part of the corporate preparation for adulthood work that we've been doing, we've been looking at the pathway for those young people, and we're talking about less than 50 in a year that go through that pathway. If you wanted some more accurate figures, then I'm sure we could get that data for you.
Yeah, that would be helpful. I think the other thing that's at the back of my mind is I'm just conscious of this. There are, I suspect, quite a lot of young people who have, mild, some form of disability, but aren't in the system, if I can put it like that. And again, I'm just trying to sort of wonder, just thinking, well, how are we reaching out to the people who aren't already in the system or aren't getting any support? Because there are people with disabilities out there, and I know of some who, for whatever reason, the nature of their disability means they don't like to ask for help or aren't able to ask for help, so they don't, and therefore they're unsupported, and they just have to kind of do the best they can. And I'm not necessarily wanting an answer now, but I just think it is something I'm just mindful of, that there is people who don't involve themselves for one reason or another.
I think we're extremely mindful that the numbers of HCPs are going up year upon year. The number of people with a working diagnosis of learning disabilities, again, is going up. We have a large number of people that have learning difficulties that we need to provide a pathway for at some point and make sure they get the right services as and when they reach adulthood. That's part of the work that's been picked up under the corporate PFA review. And one of the outcomes we're hoping to deliver from that is clear pathways for young people.
If you can carry on to E, that'd be great. Yeah. Thank you.
E was the lack of closure summaries that were not present on records for the following, or a new worker being able to pick up and start immediately. We've now included that, and that's business as usual. So that action has been addressed. It's built into the system. So anybody picking up a case record will be able to see what happened at the point it was last closed. So those are the remaining actions, and I think we've addressed all of them bar 2, which we've moved into the corporate review.
Thanks for that, Santok. Are there any further questions? No. So as I said, we've been asked to note the report, but again, we'll do it on the basis of the actions we've already agreed to take. I say if you can kindly let, obviously, Phil and the rest of the committee have some additional figures, that would be great in a period of time. And again, anything which is being passed to the CP and AR team that will come back to this, I would probably suggest late autumn from what John said. That would be great. So everybody happy with that? Thank you. We're now moving on to agenda item 9, which is the Leicestershire County Council Adult Social Care Regulated Services. And again, it's with John, Santok and Claire.
Thank you, Chair. So again, this is a follow-up report to a report that committee received in September last year. This was a report that presented the findings of a CQC inspection that took place in late 2023 at the Melton Short Breaks service, where the CQC assessed the service as requiring improvement, and subsequently an action plan was put in place to address the recommendations that have been put forward by CQC. Initial report was presented detailing the actions that the council were taking in response to that, and committee asked for an update report at a point when some of those actions had been completed. And so today's report provides assurance for the committee that those actions have been addressed, but I'll ask Santok and Claire to go through the detail. Thanks.
Again, Chair, with your permission, I'll just focus on the 4 actions that are listed in the report, if you're comfortable with that. Regulation 11 was really about the lack of consent that was being recorded and picked up within our records and our interventions. What we've done subsequently to address that, all staff have undertaken Comprehensive Mental Capacity Act a training and Liberty Safeguard training. Consent is now recorded as business as usual in the interventions and the records. We've made sure that all staff remain compliant with their training elements as well. We've delivered additional workshops where we required it, and what we've done, as you'll notice with the 4 actions, this is all good best practice. We've now taken that across all our other in-house units to make sure the other units are actually delivering the best practice as well. So it's not just focused and centralised to this short breaks provider, we've taken it across all our other in-house units as well. We've shared the learning. Any questions on that one?
Just to say, I work the report. One of the key highlights was staffing, and when you look back at the outcomes of what you've done, it looks like you've solved that kind of issue and solved that problem. So it's good to see, because sometimes things fall through the crack because people aren't in place or the correct people aren't in place, and things get missed. But I'm happy that things are back on an even keel. Thank you for that.
Thank you for that. What you'll notice later, we've still got 5 vacancies we're working on, and we're absolutely focused on getting the staffing, because you're right, if we don't have the staffing, things fall on others to pick up, and it becomes quite stressful for the individuals. But we are there, we're in a much better place. Regulation 12 was making sure that staff deliver safe care and good treatment, and that was linked to a medication procedure failure, if I remember correctly. And what we've done subsequently, we've implemented a renewed medication process procedure. Staff have been fully trained on it. We've got a new medication room in place. There's a lot more control of the medication. And since then, I think there's only been 1 incident as per the report. I don't think we've had any more since then. So it's a really good success story. And again, we've taken that learning across all the other units to make sure they are following that renewed process for us. Any questions on that? Thank you. Regulation 13 was around making sure we're safeguarding our vulnerable adults, and in order to make sure that we can provide assurance for ourselves and yourselves as a committee, we've absolutely ensured staff are compliant with their mandatory safeguarding training. We've delivered extra workshops around safeguarding. And on top of that, all staff are aware of how to act the whistleblowing policy if they have a need to. So I think we're in a much better place in terms of training and compliance around the safeguarding of vulnerable adults. Any questions on that? Nope. Okay. And finally, coming back to the staffing, so again, mandatory training in place. We're working with staff to enhance their learning, their knowledge, and the awareness of the areas that are important and their impact on people. The one bit we're, as I said, still struggling. We've got 5 vacancies at the moment, support workers, but actually it's in a much better place than before. We've now recruited a manager that's looking at enhancing that recruitment process for us. On top of which, we've embedded an EDI agenda within the provision. And again, that's being shared across all the other provisions as well. So we are in a much better place. Any questions on that?
Yeah, I don't think that's a question about a particular part of the agenda, but again, just a thought going through my head is, and I do understand the need for short breaks for people in very stressful caring situations like this. But what I'm also interested in is, well, how often are these short breaks services, facilities actually getting utilised? You know, what versus what their capacity is. You know, so I'm just wondering what the kind of, whatever you call it, I will call it occupancy, but usage basically of these facilities. How much is it actually getting taken up and used compared to the actual, you know, capacity? You mentioned staffing shortages, which is why that was flagging that up to me. If you've got staffing shortages, that surely that reduces the operational capacity you've got. I'm not quite clear what capacity, what that means in terms of this, because that's not looking at this. Thank you.
You're absolutely right. The staffing does dictate the occupancy. Unfortunately, that's one of the key areas we're working on in terms of increasing the staffing group and making sure we've got the full complement of staff required. In terms of usage, it's not quite where we want it to be. I'm sure we can make much more use of it, and that again is being picked up as part of our short breaks review. And again, that's a piece of work we've started. And I'm assuming that we'll be reporting it back here at some point, the outcome. But it's not where we want it to be.
Just to follow up on that one. So it's a bit like the previous report. So the first report we brought did have those figures in it. It's fair to say it varies across the different short break services. So it goes from about 70% down to 40% in one of our services where we really are having difficulties in terms of recruitment. The Melton short break service, I think, is probably about the middle of that range. So it's about 50, I think 50-60% at Melton. One of the paragraph 17 refers to the short breaks review that Santok was just talking about as part of our prevention work and part of our MTFS work. And we've been looking at whether or not we could get better value from either commissioning from external markets rather than providing it ourselves. So it's that sort of make or buy kind of review, but also looking at where we might be able to, if we're going to continue to provide it in-house, is there an opportunity to increase the occupancy, increase potentially income into the service by selling services to others? And certainly we've looked at the fact that there are, at the moment, we have the in-house service, but we also commission services from external providers for short breaks. So we've been looking at the cost differential between how much does it cost us to provide them in-house, how much does it cost to buy them externally, and we've identified a number of people who are having external services where there may be an opportunity to bring those people into the in-house service if it meets their needs. So we'd have to take obviously individual reviews around that. We've also been talking to colleagues in other local authority areas and the NHS to see whether or not there is a demand that could be met from our services. And those conversations continue, but it's looking positively at potentially having beds available for other authorities to buy from us, which offsets the cost of providing the services as well as obviously increasing the occupancy. As Santok said, we'll bring that back to committee at a later date in terms of what the findings of that review are. But there is that opportunity there.
I will do, Phil. I'll just add to that. I mean, we have looked at this in depth at this committee. That's not to say don't ask any questions. I'm just saying that I just want to give you the assurance and anyone watching the assurance. We've looked at this in depth. We've looked at what's best to, how to best provide the service, how best to get best value for money for this council, as well as the best quality of service for the users. And it's one we will continue to do, just so that everybody is aware of that. So back to you then, Phil.
Yeah, thanks, Chair. Thanks, John, for that more detailed explanation. And it's good to hear that we are looking at this, because clearly what we don't want to have is assets sitting there not being used, because that's expensive. And if we're then funding people to go somewhere else, yeah, that does raise those questions in your mind as to why we're doing that. So I'll wait to see what that comes back. Thank you, Chair.
Thanks, Phil. Fiona.
Thanks, Chair. I think Healthwatch would look at paragraph 15, which is around the feedback that you're getting around the short breaks. It's really positive. I'm assuming all that feedback is since you've implemented the training and its impact it is having. And it's really good. And it poses the question, really, I suppose, how do you go about collecting that feedback on an ongoing basis? Because this is a very short-term issue, so people come and go. It's about that live feedback. So firstly, the people that are actually using the services are enjoying the experience and getting a lot out of it. And secondly, it helps confirm, I suppose, that the training has worked and any ongoing issues can be picked up and identified straight away and addressed. So how can you just share with us how that ongoing, it's not a consultation, but how that ongoing feedback loop is actually being closed on a regular basis? Thanks.
So after each stay, there'll be a telephone conversation with the parent carer for the person that's accessed our service so we can get that feedback. And that's a two-way process. So we're providing information about how the short break has gone for that person, but also getting any feedback from parent carers and the people who are accessing. So that takes place after each visit. And for example, at Melton Short Breaks, they have a users group, so they get together collectively periodically to talk about how stays have gone, suggestions that people have got, compliments, complaints are discussed at those meetings. So they're communicating on a regular basis through that forum as well to gather that feedback and to inform future service delivery. Thank you.
And I think it's also important to remember a lot of the young people use the service regularly. It's mapped out for over the 12 months and they come back regular. And that feedback is constant. And that's really a good marker of people wanting to use the service going forward. And the impact is very, very positive and it's valued.
Thanks for that. It's really helpful to know. How can that feedback inform the review that's being done now? Because that will be part of the, I suppose, identifying the need aspect.
There will be a strong co-production theme within the review itself, where we invite people who actually use the service, young people, to come in and incorporate their views and their kind of thoughts and patterns really into that review in terms of making services much better.
Thanks for that, Santok. And oh, sorry, Christine.
Thank you. I am now. Yeah, I'd just like to reassure the committee and anybody listening in that as soon as we heard of a bad report back, Ted and I went out to see at Melton Mowbray Short Breaks, and we regularly visit all 3 short breaks to make sure that they're all, running as they should be. So as lead members and Ted, we do keep an eye on everything. So I can assure you that nothing goes on, everything comes through to our lead members meeting anyway if there's any concerns.
Thank you, Christine. And so I think this is one where we did have a further chat in the chairman's briefing about the fact that obviously you get a CQC rating, but of course the CQC then disappear into the ether, and we may not see them again for the next millennium. So we had briefly discussed with John how we can keep on top of this. It's clear that further reports will come back, but I know John was investigating some thoughts on how we can continue to benchmark the quality of what we do, which comes back to the point you're making, Fiona, and the point that Christine has covered off going forward. And I know that there will be regular reports, but I think John was looking at a more systematic way of potentially reviewing all 3 of these areas, particularly as we move forward into whatever change they morph into, i.e. still run by us, outsourced or whatever. But I think it comes back to where we started. There is a commitment from our officers to ensure that we get the best value for this council and the best value for the residents, and the 2 have got to go hand in hand. So I think if we're happy with that, we'd note the report. We're now moving on to the final report of today. So could I thank Santok and Claire for their contribution over the last 2 reports. I think we've got Inderjit and Paul joining us. I'll give them time to whip into their seat. Right, so the final report for today is agenda item 10, which is pages 49 to 66. This is the Leicestershire Adult Learning Service Ofsted inspection findings. And John has said he's joined by Inderjit, the Assistant Director, and Paul, the Head of Service on this item. So, Inderjit's getting thrown straight in the deep end.
That's all good. So I'll just do a very, very brief intro and then hand over to Paul. So it's a really good news story. from our perspective, obviously the report details the outcome of the Ofsted inspection, which was held in January. And it is, like I said, it's a very positive piece for us as a directorate. We're really proud of the outcome of the Ofsted inspection. The report details the strengths that the inspectors found. I'll let Paul go into the detail of that, and then it also talks around some of the development areas, which we're inevitably going to get from an inspection. But yes, I mean, Scrutiny has to look at the, note the comments, or note the report and make any comments moving forward. It is going to Cabinet as well later in the month. And over to you, Paul.
Thank you. Good afternoon. So yeah, just a bit of context really to start off with, and then I'll go into the sort of some of the key findings. This was the first inspection since 2018. So on a normal inspection cycle, it would be a 5-year cycle, but with COVID and other things, the inspection was delayed. So it has been some time since we've had a report. The service is scrutinised in the same way as further education colleges would be. In terms of the work of the service, it's a large service dispersed across Leicestershire, so quite a broad curriculum as such. And the provision itself is quite complex due to that, due to the different subject areas that have been delivered. The inspection framework is such that we go from inadequate to outstanding on a 4 in terms of the criteria. And in terms of the themes that are inspected, we have the quality of education, behaviour and attitudes, personal development, and leadership and management, which contributes to an overall effectiveness grade. The grades awarded at the last inspection, it was good across the board in 2018, and delighted that, again, with this inspection, all areas are recognised as good. So that's a positive outcome. There is some detail in terms of more detail in terms of the findings. In section 24, key strengths and areas for improvement. There was exceptionally high levels of learner satisfaction, so very, very positive. There is an inspection questionnaire that Ofsted inspectors ask learners to respond to. I think there was 222 responses to that questionnaire in the first couple of days, so it's about 10% of the learners on programme, and the 97% of those responding said they would recommend the service to family and friends, so that's very positive. Importantly, I suppose the intent of the service is very much to support people develop their skills for employment, career progression, and so on, and also support independence and well-being. And that came out within the report very clearly in terms of how the programmes are supporting that work. And in terms of support for additional needs, the service does work with a large proportion of learners with some kind of additional needs. So that was seen as effective as well. And final point around governance, good support through governance, scrutiny and so on, which underpins positive outcomes. In terms of areas for improvement, there's 3 areas identified in the report. Careers advice for learners, adults attending tailored learning programmes. So that's programmes without some form of accreditation. But inspectors did acknowledge that careers are not always what people are looking for from these types of courses. There are other outcomes as well. In terms of other aspects, quality assurance, a bit of work to do around quality assurance to ensure consistency across the service, and some focus on teaching and learning, particularly in the ESOL and apprenticeship programmes. So that is the findings of the report. In terms of following up, there is a quality improvement plan which has been drawn up to address those areas for improvement.
Thank you very much, Paul. Any questions? Fiona?
The numbers have been rising over since COVID. Certainly the programme took a big hit during COVID. There are spaces available. The programme for next year, because we work on an academic year, is being developed currently, and broadening opportunities where we can.
Thanks. That's really interesting, and the other side of me just wonders whether there is any room within this system to promote particularly careers around health, well-being and social care, so that we're kind of growing our own staffing, because staffing a workforce seems to be a particular problem, which is obviously impacting on the availability of services for people that need them. So I just wondered if that was thought of to kind of build on this great report.
Certainly within the adult learning strategy and the departmental strategy, there is collaboration around apprenticeships for care workers and so on. So the adult learning service are delivering and supporting people working in social care.
Bill?
Yeah, thanks, Chair. So first of all, I will say this is a really good report, and excellent that you've managed to achieve good across the board with Ofsted, because that's not an easy thing to do. So that's really well done. But building on what Fiona just mentioned, I do think there is probably more potential for this service to really be an agent of change for the workforce in Leicestershire, because at the end of the day, the world of work is changing very rapidly, and people of all ages need to acquire new skills. And we have a lot of very small and medium-sized employers who, for whatever reason, aren't very adept and very good at necessarily at being able to source or provide training, quality training. So the fact that the County Council, in its capacity, is in this role, has achieved a good rating from Ofsted is something which is very positive, and in effect acts as a badge of quality stamp really on the learning that we are providing for the learners who are engaged with this. So I think it does need some more thinking about how we can really build on this to really make it an action, an engine of change, and really equip the workforce, or people in the workforce who want to get back into the workforce across Leicestershire at all ages, not just people who want to learn how to make nice pottery, which is important as well, because that's learning and skill and all the rest of it. But we also need to have people, as has been mentioned, who can do the health and care, as well as understand what AI is about and how to grow the economy. So I hope that this is something that will be being looked at very intensely over the next few months. Thank you.
Yes, thank you. Certainly we'll take on board those comments.
Thank you, Phil. Thank you, Paul. Any further questions? Christine?
Well, it's no question really. I'm just very pleased with the report, but I've got to hands up and say it's nothing to do with me, because Ted looks after this section for me, and I know he goes out regularly and meets regularly with Paul. So yeah, I'm pleased with the results, and thank you, Ted, for all the work you've been doing. Thank you.
Thank you, Christine. Ted?
Yeah, the adult learning department did prepare very well for this probably what a lot of people aren't aware of is that in November we had another inspection with through the invitation, the council had brought in some further education inspectors from the Department of Education who sort of did a mock Ofsted inspection, and they were also of the opinion that their opening comments to us on that Monday were, you know, you are good and should be aspiring for outstanding. So it was heartening to see that they were able to see the progress we've made already, and there were some recommendations that we took in time for the Ofsted inspection, and you can see the results it delivered. We got good in every domain. So well done to the staff.
Thanks for that, Ted. Right, the absence of any final questions, I'm just going to indulge myself for a couple of minutes, really. So whatever happens at the election, this will be my last meeting as chair of this committee, because I'm not standing for election. That's probably why. I'd just like to put on record my thanks to particularly John and all the officers who've presented to this committee. I'd also like to thank all my fellow committee members. I think this has been a privilege to do this job, and I do believe that as a committee we have added value to the work of our officers, so I hope they feel that as well. Could I also particularly thank Angie for keeping both me and the committee on the straight and narrow over the last couple of years. It's all well and good sitting here, but it's really nice when someone just gives you all the stuff and you don't have to prepare for it. So yeah, we are a good council. I think this has been a really good, lots of work done by adults communities. I'm very proud personally of what adults communities have achieved in my time as chair of this committee, and I think the residents of Leicestershire should be as well. So with that, I said I thank you all. The date of the next meeting is the 2nd of June 2025, whoever is here then, and there are no urgent items, so I will declare the meeting closed, and thank you all.